I'm Dr. Wesley Barry, and if you're here today watching this film, you're about to have some type of gastrointestinal surgery. What is that? The surgery of the GI tract includes many organs inside of the abdomen, from the stomach, which is the first organ that we come to the gallbladder, to the ducts that the gallbladder attaches to the small intestine, and the several parts of the large intestine, the appendix, the right colon, transverse, left, sigmoid, and rectum. All of these are part of the GI tract. And these are the most common parts that are operated upon. Again, if you're here, you're either about to have removal of a part of, or sometimes the entire organs that we've just mentioned. Most of these are done in association with either infection or tumors. These tumors can be cancerous tumors or non-cancerous tumors. If you have not already been made aware of that, then that's something we'll discuss in private. However, I did want to give you a brief overview of what to expect. Gastrointestinal surgery all follows pretty much the same script. If we're doing it as an open operation as opposed to laparoscopic, then the things that we do and the way that we do them are quite different. The most common open gastrointestinal operation that I perform would be removal of one part of the colon, either right or left, or the very low part of the rectum, which we call a low anterior resection. Other less common entities would be a gastrectomy, removal of the stomach. Of course, most of these things are done for tumors. In any event, there would be an incision in the midline of the abdomen. The operation would take anywhere from 1.5 to as long as 4 and 5 hours, depending on the procedure. And you'll have a hospital stay of usually 5 to 7 days, sometimes shorter, sometimes longer. Most times it will involve you having a tube in your nose that will decompress the GI tract while your gut recovers after surgery. This is routine and will be removed after you have your first episode of flatus, or passing gas. On the second day post-op, we'll be monitoring you very closely for things like fever and heart rate. And usually by the third or fourth day, we're able to remove the tube and start you on ice chips and a liquid diet. The most important part of the operation, of course, is that we're successful in removing the organs involved that may contain tumors. And to remove them, we also remove the lymph node bearing areas of those tumors. Those help to determine what the ultimate prognosis will be. The biggest and most disconcerting complication from any kind of gastrointestinal operation would be the leakage of the anastomosis that we make between organs. When I remove part of the colon, then I put it back together. In putting it back together, that has to be an airtight seal. If it doesn't seal airtight, then after several days, GI content or liquid feces essentially will leak from that anastomosis and contaminate the operation or cause some infection. If that happens, I would have to reoperate to repair that. Again, these are not things that occur very frequently, but they're things that we want to fully inform you about. Other things that occur, although rarely, would be bleeding, again, injury to other organs in the operative field, and need for reoperation, sometimes because we may not know what's going on. If your course is not following that that we think it should be, I may elect to explore you to discover a problem that other x-rays can't tell me. All in all, this is going to be as pleasurable a procedure for you as it can be here at Advanced Surgical Associates. I'll be your operating surgeon and I'll be taking care of you on a day-to-day basis. One other thing, afterwards, I do want you and your relatives to understand that this is an ongoing process, even after this 5 to 7 day stay. You will go through a period of what we call catabolism. It'll take about 6 to 8 weeks before you'll start to regain your appetite and to regain your energy level. And all of this is perfectly normal. Expect to lose about 5 to 10 pounds during this process. I look forward to meeting you in the holding area just prior to surgery and hope that you'll have as pleasant of a hospital stay as we can give you. Thank you for coming.